Thank you for inviting me and giving me the opportunity to speak to you about OSI and making food during a pandemic. The topics that I want to cover to you today are the controls that we put in place to reduce the spread or to flatten the curve of COVID-19 in our manufacturing sites. Talk a little bit about the government actions that were or were not taken at our sites, and then discuss about how we reduced food waste through extending shelf lives or best before dates. I just want to start with you about the confusion that everybody had during the initial phase of the pandemic when government lockdowns started to occur. The picture that you see on the left there is the last day that you could arrive from Europe into the United States. This was March 15th, 2020. What you're looking at is the receiving hall at Chicago International Airport. Of course, you hear when you disembark on the plane and you see all along on the walls literature that had been printed about social distancing. But clearly the biggest threat for me and my health was on this day when I arrived into Chicago with 4,000 other people, and I was stuck for 5 hours as I progressed through this process and in close and constant contact with people that I didn't know. I found a video that will help clarify what all of the restrictions and things that people were obliged to do. So I wanted to play it for you. It's a 3-minute video, and I think that you'll have a better understanding and it'll be more clear to you on what restrictions were in place at this time back, I would say, between March and July of last year.
Yeah, I really don't understand why everybody isn't following the same rules right now. They're very clear, so let's take a minute and let's go over them again. First, you must not leave the house for any reason, unless of course you have a reason, and then you may leave the house. All stores are closed except those that are open, and all stores must close unless of course they need to stay open. This virus is deadly, but don't be afraid of it. It can only kill people who are vulnerable and also those who are not vulnerable. We should stay locked down until the virus stops infecting people. And it will only stop infecting people if enough of us get infected that we build immunity. So it is very important that we get infected and also do not get infected. You should not go to the doctor's office or the hospital unless you have to go there. Unless, of course, you are too sick to go there. This virus has no effect on children except for those children in which it affects. The virus remains active on different surfaces for 2 hours or 4 hours or 6 hours, but in most cases it's days and not hours, and it needs a damp environment or a cold environment that is warm and dry in the air. Unless the air is plastic. Schools are closed, so you need to homeschool your children unless you can send them to school because you are not home. If you are at home, you can school your children using various portals and online classrooms unless you have poor internet, more than one child, only one computer, or you are working from home. Baking cakes can be considered math, science, or art. If you are home educating, you can include household chores within their education curriculum. And if you are home educating, you may start drinking at approximately 10 a.m. every day. If you are not home educating children, you may also start drinking at approximately 10 a.m. Masks are useless at protecting you against the virus, but you still need to wear one because it can save lives. And in some cases, it may even be mandatory, but also maybe not. You must not go to work, but you can get another job at which point you may go to work. Stay home. I don't know how many more celebrities we need to have tell you how important it is to go outside and take care of your mental health. There is no shortage of groceries in the supermarket. There are simply many things missing. You don't need to go buy a bunch of toilet paper, but you should buy some in case you need it. If you are sick, you may go out once you are better, but those in your household, they cannot go out once you are better unless, of course, they need to go out. Animals are not affected by the virus, except for that cat that tested positive in Belgium in February. plus a couple tigers. The number of corona-related deaths will be announced daily, but we don't know how many people are infected because we were only testing those who are almost dead to determine if that's what they will die of. The people who die of corona who are not counted won't or will be counted, but maybe not. To help protect yourself during these times, you should be eating well and exercising, but exercising only eating what you have at home to avoid going to the stores unless you need toilet paper or a fence panel. It's important to get fresh air, but don't go to parks, but do go walk in other places. Just don't sit down unless you are old or pregnant. But if you do sit down, don't sit for too long. Unless you are old and you are pregnant, in which case you need to sit down. But if you do sit down, don't eat unless you've had a long walk, which you are allowed to do if you are old or pregnant, except for times in which you aren't. Don't visit old people, but you have a moral obligation to take care of old people and bring them food and medicine. And finally, no businesses will go down due to coronavirus except those businesses that go down due to COVID-19. I hope this cleared up any questions about what we should and should not be doing during this time. Please educate your friends and family with this information so we can remove any and all confusion surrounding this time. Thank you.
So I think that clears it all up. So I want to start next with, in going through the controls that OSI put in place at all of our sites. We had to consider how we would continue to manufacture and have our employees feel like they were kept safe. So the first thing we did was we changed our operating schedules and we staggered shifts. We put in 30-minute gaps between shifts to assure that the first shift left before the second shift arrived on the floor. We had the employees enter on a single file, one by one enter pattern so that we can collect their temperature. We were trying to avoid them congregating in areas around places like the time clock, hygiene stations, or even trying to get coffee in the canteen. We reduced the number of people that were allowed in a changing room at one time, and we put in place a lot of visual markers to help them understand better social distancing and what was important. We implemented personal defense. In most cases, our employees who were not wearing nose and mouth masks during routine operations. I would say this was probably our first challenge in trying to find a supplier and secure the amount of nose and mouth masks that we needed, because they were disposable every day. We had a lot of employees and we were buying them for our employees around the world, not just here in Europe. So it was really quite difficult to try and secure the volume that we needed. The temperature monitoring person that was monitoring the temperature of every employee that entered our site, they were in contact with every single employee. They were really at high risk. So we provided them also a nose and mouth mask, a face shield, gloves, disposable outerwear that they could remove before they went home for the day. In places that we couldn't keep social distance, we put in barriers, physical barriers like plexiglass. And where we couldn't put barriers in place, we provided eye protection in the form of goggles or a face shield. Inside the operating space, in order to create social distance, we put barriers in place. We hung plastic curtains or installed we installed hard plexiglass so that the employees would have a barrier between them, because in many places they were in close and constant contact for almost more than 8 hours. Where we couldn't do these types of things, where we couldn't put barriers in place, we provided our employees with eye protection. So on the shop floor, you would see employees either wearing goggles in addition to the nose and mouth mask, or face shields in addition to the nose and mouth mask. When it came to hand hygiene, of course, we're food workers, so we do know how to wash and disinfect our hands. But we wanted to train them and give them frequent communication about the right etiquette when they were coughing or sneezing. Also, when it came to hand hygiene, every employee was expected to disinfect their hands before they entered the site. So before they even touched the doorknob or the door pull to get into the site, they had to do a disinfection. So we put in a lot of temporary solutions. We made them more visible to give them the opportunity to disinfect before entering the sites. To help our employees feel better and also to, I would say, influence them when they're not working for us and they're at home where we don't know what their behaviors are, we provided them with home kits. And these home kits were delivered to the employees more than once already. And inside them were a bottle of hand sanitizer, a bottle of hand lotion, because we know the sanitizer can be quite harsh on your hands, a mask, which is a kind of a cloth community style mask, and an information letter that provided more information about the disease, as well as some websites that they could go to and learn more for themselves. The information letter, of course, was put in the local national language, and these kits were really quite well received by our employees. Part of our employee well-being and to help them feel safe when they entered was to do temperature monitoring of all employees as they entered the site. And this also included any service workers or contractors that were working on site. We started with using handheld devices, but then eventually moved to installing full body thermal imaging cameras. And the thermal imaging, in most cases, they were installed with alarms, so it made the process of entering the site more efficient and effective. Also, any visitors that came to the site had to do a documented health questionnaire, which then it was approved by the person that was also collecting the temperature on whether they could enter the site based on their responses in the questionnaire. Our employees just had to give a verbal confirmation. Some other things that we did to help our employees feel safe is we restricted access to all the sites. So any visitors that were going to come had to be approved visitors. And we basically eliminated any business travel from corporate offices or from site to site. We provided regular communication about the OSI Make It Right hotline, which is a hotline that an employee can report a concern in an anonymous way. And then we also had our HR folks continue to follow up with anybody who tested positive and wanted to make sure that we understood who their contacts were or who they were in close contact with while they were working on site. And we just wanted to, track their overall health so that to understand when they could return to the work. OSI provided regular and routine training, communication, and educations. A lot of this came in the form of a printed information sheet about the current status in that national or local community. Also, there were messages from the leadership still continuing to express concern for their employees. Our company president recorded a video, as well as we have town hall meetings. We still have them today every month where the president of the company is talking about the disease and how it's affected OSI and OSI's business. We ran on loops in all of the canteen monitors a short video about COVID-19 and put up a lot of printed material, visual markers to help employees understand the criticality of this pandemic. And the last thing I want to cover about controls, maybe it's not really a control, but how do we navigate our way through testing, and what about vaccines as they become more available? When we had positive test results on site, we did notify our local authority, and we saw that when we had more than 5% of our employees sick, that our local health authorities wanted more emphasis or have more focus around that site. In several of our sites, the government tested all of our employees, especially when we started seeing a high level of absenteeism. And in one state in Germany, North Rhine-Westphalia, the federal state government took the action to mandate testing twice a week of every working employee. This continues as ongoing today. With the government and the inconsistent actions that the government took, you would imagine that this created a lot of anxiety, some uncertainties, and even some things that became really annoying. For the first challenge was for us to find laboratories that had the capacity to be able to test our employees. I mentioned North Rhine-Westphalia because we have 3 manufacturing in this area. And so this meant that over 1,000 employees needed to be tested 2 times per week. And we needed to test employees across 3 shifts. We didn't think it was fair to ask employees to come in at their non-scheduled time just for a test to be collected for them. So not only did we mentioned that we were challenged in trying to find laboratories that could do this testing, we had to understand the methodology that they were using to run the test. What was best for OSI and our employees, not necessarily what was most efficient or the fastest. I think our biggest challenge came when we were looking for people to collect the samples. We were looking for a medical professional to start with, and either they didn't want to, or they were in such high demand in this localized area that it was really difficult to find somebody. During this time, we needed to help our site managers really understand the difference between the tests. And while they wanted something fast and they wanted to get results out, we needed to help them understand that the fast test might not have been the right test during that time. The biggest and most annoying thing, and it continues to happen, is the test companies, the test kit companies, continue to reach out and solicit new business from our site managers and from our directors. And it's annoying because it just is time consuming to restate to all of the plant managers about why this test isn't going to work or why it's not important or not allowed. Now we are, I think, in a good position when it comes to testing our employees, whether it's via way of the government or we're choosing to share our test results with the government. I think we've gotten through this. We found the right labs and the right method. When we talk about vaccines, as they become more available, you can imagine that the vaccines are quite available in the United States, and in other areas, like in the UK, they're really moving vaccines forward quite quickly. But our food workers are considered essential workers, and they fall someplace in the continuum of when to be vaccinated. Definitely after the elderly and the most at-risk population, but maybe before the 20 to 30-year-olds. So we started working with our local health departments to provide the opportunities and solutions to get more people vaccinated. We offer in some of our sites in the United States with the local health department, we obtain the drug to vaccinate our employees, and then we provide the site and the doctor to do the jabs. This is working out quite well, and it's a good solution at the moment to get more people stuck. So how effective were our controls? Well, we did not have a single OSI site closed by the local authorities due to COVID clusters at our sites. We did see when the positivity rate, though, was greater than 200 per 100,000, that our plants started to have more absenteeism. In the US, we did close 3 sites because of clusters, but OSI took that action, not the government. And it was clear to us that when the community is infected, our food plant gets infected. It's not the other way around. Our food plant workers are not infecting their community. It's really when the community infection rates are higher. We did learn that it was important to have close relationships with our local authorities so that we could influence their decisions and help them understand the controls that we put in place in relation to maybe what other companies put in place. Associated with temperature monitoring around the world, we have not identified a single person with a fever, which we defined as greater than 37.3 degrees Celsius. And then from the attitudes of our workers, I think they feel safe coming to work because they do continue to come. And when they're sick, they stay home. So we didn't really have to do much more influencing related to that. I just want to cover off on product, and then so early in the pandemic in March of 2020, when the lockdowns happened, it was just really across Europe a rolling lockdown, right? It's for us and our business, it started with Austria, and then it was Germany, Spain, Poland, Hungary, and then the United Kingdom. And in most cases, these lockdowns were between March and April. In some areas, I think the United Kingdom, it even went into May. With this first lockdown, restaurants were closed. There was no chance for drive-through, no chance for pickup, no chance for delivery. They were closed. This made it really difficult because I think many restaurant chains weren't prepared. They weren't prepared for how their business would manage this in the future, and they didn't really understand what quarantine meant for their businesses either. Then definitely the retailers for food, they were still open, and I think the restaurants then made a point of finding solutions to get some product moving through their restaurants. And this came in the form of deliveries and drive-throughs and pickups. During this time, these first initial lockdowns though, in Europe, OSI had more than 1,000 metric tons in market. So it was either in the restaurant, in distribution, or in storage in the market. And this product was worth more than 5 million euros. Most of it was most of the product was frozen, but it had shelf life between 90 days and 120 days. Initially, we didn't think this was going to be a problem. We just didn't think that the public, in our opinion, would stand for this lockdown for an extended period of time. But it quickly became evident that we needed to address this product, that we wouldn't be able to maintain it in the market with the stated shelf life that it had. So in 19 markets that we serviced, they were all closed. Some of them started opening for a blend of drive-through and deliveries, but really our product was not moving the way that it normally was moving through the markets. It was really moving slow. We closed 8 plants because of the level of inventory we had in the market. It had nothing to do with infections or clusters. It was just solely related on the fact that we had so much product in the market and there was no need for us to continue to produce. These 8 sites that we closed or suspended, let's say, most of them were reopened by May. So we had to answer the question about what to do with all of the product. Not only what to do with new product that we will produce, because we're going to be operating in a different way now, but how do we manage with the product that was in the market, because we didn't want to waste food. So we did agree with our customers to extend the best before shelf life for most of the products that are already in the market. Then we went through a process of agreeing with local authorities as well as that customer on how to visualize the new longer shelf life. Did we have to repackage this product, which we really didn't want to do. We didn't want to move it back to our sites, repackage it just so that it would have a new longer shelf life. Were there other solutions that we could use via a letter, relabeling, crossing out the old dates? So I think that depending on which market the product was in, we had a combination of all of these types of activities that went through. In the end, 90% of our products, they received new longer shelf lives. We didn't waste food, which was the intention and the purpose that we wanted. When we restarted our operations in May for those 8 that were closed, typically these machines, they run and they run hard every day, and now they stopped for 3 months. So we went back through and started our lines up slowly, but then we had to retrain all of our employees on how to use these new defensive PPEs. So we had to talk to them about using a mask and how to use it and when to use it, and the etiquette around putting it on and taking it off so that they don't contaminate themselves. And yes, of course, second lockdowns, third lockdowns, it continues, but OSI knows how to behave in this way now. As it relates to the products, just some conclusions. All of our food service products received new best before dates, and we did not waste food. The best before dates were extended somewhere between 50 and 60 days, but all of these products are sold frozen. Our refrigerated products, we verified the current stated shelf lives, but these products moved through the market because they went through retailers and there was a high demand for retail. All the extensions that we gave on the best before dates were validated with the data we already had at the sites. So we didn't have to create any new testing. We didn't have to start new shelf lives and wait 3, 4, 5 months for the study to be over. And then we did get approval for extending the best before dates for any new products that we produced, and that approval is a temporary approval. I think it goes until June this year for most products. We'll see, it may have to be extended again. And then the last thing that I just want to raise is the new language that the food safety professionals had to learn, new terminology. Their traditional food safety terminology had to move into the public health arena, which most of us probably, because we have science backgrounds, didn't really struggle with or didn't have a problem with. But we moved from talking about HACCP, and maybe we even applied our HACCP knowledge and HACCP approach into COVID controls and COVID risk assessments. But we talked about foreign material typically and allergens and CCPs. But now with Corona and COVID, we have to talk about antibody tests and antigen tests. We need to, when it comes to RT-PCR, we need to understand what the difference is between real-time versus reverse transcriptase. CT was a new one for me, and this meant cycle time, and it was associated with PCR tests. In one case, we had a plant where the government came in and ran PCR tests of all our employees in September. But then that site had clusters forming, and the government wanted to come back and retest the site in February of this year. And we had 9 employees that tested positive a second time. And the CT time became critical for those 9 employees because the government or the health authority basically told them, because their CT number was greater than 30, that they were not infectious. We needed to understand the difference between a nose swab, a throat swab, and sputum, and what that meant for the reliability of the test and the test results. And what do hard lockdowns versus soft and partial lockdowns mean for our business, and quarantines and curfews, and we continue to social distance, and now we have a new one with vaccines that we're talking about jabs or sticks. So I hope that I provided you with information about OSI related to how we are acting and the controls that we put in place to address the risk of spreading the disease or flattening the curve, or I would say just keeping our employees safe. Thank you.